Hi, Dave with Align Therapy here. I am going to talk about a simple and easy exercise that you can do for scoliosis or kyphosis or back pain. I did a video previously on elongation of the spine. We do that a lot in Schroth method exercises for scoliosis and things like that. And so this is video or exercise number 2 that is a simple and easy exercise that you can do to help improve back pain, scoliosis, kyphosis, those things. So keep in mind, this isn't a specific exercise that is scoliosis specific exercise like the Schroth method or the C's approach or anything like that. But it can be helpful if you're having back pain with scoliosis, and let's say you're a teenager developing scoliosis. This is an exercise that I actually will do with a lot of my patients. So we'll get into the exercise. Don't forget to subscribe to the channel and stay tuned for other exercises that I'm going to do. We're trying to do about 10 simple and easy exercises for scoliosis and kyphosis. So this is number 2 of the 10, and hopefully you find it helpful. So this exercise is a just abdominal plank exercise. Most people know what this exercise is, and I want to talk about the exercise, I want to talk about how to do it, and I want to talk about how to do it correctly, especially if you have scoliosis or some other spinal deformity. So a plank is a great exercise for core stability. It's a great exercise to get hip and core and back and pretty much everything contracting at the same time to add stability to the spine. The problem is most people do planks with bad form, or they go longer than they should. And I'll show you what I mean by that. A plank is just usually I'm talking on elbows and toes. You can do it on your hands and on your toes, but usually I'm talking about elbows and toes. So let me demonstrate what a plank is, if you haven't seen one. So a plank is on your elbows and on your toes, and you're holding your body nice and straight like a plank. So what we look for in this position with form is that we're not arching down like this. We also look that we're not arching up like this. So good plank form is just straight in a plank like this. So holding this position for as long as you can while you maintain that good form. So watching for the good form, watching for when the low back starts to arch, or you start to, I call it a stink bug position, where your hips go up, your butt goes up in the air. If that's happening, you should stop, because your muscles are getting fatigued if you can't control that. So that's just generally good form. If we're talking about scoliosis or kyphosis, it changes a little bit, because we have some rotation in the hips, we have some rotation in the back. We usually have one shoulder blade that's less stable than the other shoulder blade. So when you're in a plank position, if you have scoliosis, we want to make sure that the hips are staying level, that the back side of the hips are staying level, that one side isn't dipping forward or down, or the other side isn't dipping down. Most of the time, if the pelvis is involved with scoliosis, which I would say the majority of the time it is, that rotation is something that you need to control. So if you're in that plank position, have someone watch you, and if one side of your hips are going down, have them help you to know when your pelvis is level, so that you're not doing a plank in an unbalanced position. Same thing with the shoulder blades. If you notice one shoulder blade poking out more, see if you can correct it. If you have rotation in the trunk, we're just trying to get symmetry, trying to get your body to be more symmetrical. I mean, scoliosis is a deformity that's asymmetrical, side to side. So we want to increase the symmetry as we do this exercise. So watch for those things. That's something that's fairly easy for someone else to see if they're watching your back while you do a plank. Looking for the pelvis to be level, looking for the shoulder blades to be level, looking that your low back isn't arching. If you have kyphosis, there's one other thing to watch. So in kyphosis, we have more of a rounding of the upper back. So trying to bring that down as much as possible so that it's flat. But when we have a rounding in the upper back, sometimes when you try and correct that, you start to arch your low back into more of a lordosis. So if that's happening, try and correct it as best you can. Sometimes you can't totally correct the kyphosis and can't totally correct the lordosis, but try and control it as best that you can. So I would suggest, if you have a significant scoliosis curve or a kyphosis curve, that you work with a Schroth-trained therapist or a scoliosis or kyphosis specialized therapist. They can help you to know specific exercises for your curve and to know if you're doing these exercises correctly. So the plank is a great way to strengthen the core muscles, even the shoulders. When I do these, I usually feel it in my shoulders. You get a lot of bang for your buck with a plank. And usually, if a plank is done correctly and not too long, usually it's a pretty safe exercise to do. So if you've had back surgery or you've had a significant injury to your back, you probably want to check with your doctor or a physical therapist trained in scoliosis before doing that. But most can do a plank. If it hurts, other than muscle soreness, then maybe back off and don't progress too far into that, but work your way up to holding it for 30 seconds, 45 seconds, up to a minute. Usually my patients, I have them hold it up to a minute and a half, and once they get to a minute and a half, we start to make it more of a dynamic plank where they start to move their legs and things like that. So exercise number 2 is a abdominal plank. And it's a great exercise. I have patients do it all the time. So if you have questions or comments, please put those comments in the comments of this video, and stay tuned for video number 3, and hopefully this was helpful. Thanks for watching.